Hello.
Hi there, a prescription for Molly Dixon, please.
Yeah, 1 wee second. Yes, I have a wee prescription for Molly here. Can I get you to confirm her date of birth?
Yeah, it is the 3rd of May 2015.
That's perfect. I see Molly's been prescribed an inhaler here.
Yeah.
Are you Molly's dad?
Yes, I am.
Yes. And has she ever had an inhaler before?
No, she hasn't actually, but the doctor said to try this because she's been showing signs of asthma.
Okay, perfect. Will you be the person who gives Molly her medication?
Yes, sometimes I will, but it'll probably be more my wife, Cara,
Okay.
who gives it to her.
And are yourself or Cara familiar with how to give inhaler medication?
No, never used it before.
Okay. So what I can do is I can talk you through today how to use the inhaler and the spacer. So a spacer is a device which makes it easier to give asthma medication to children.
Okay.
And I can check, do you understand that okay? And then if you can get Cara to pop in and see me maybe someday next week when she's passing.
Yes,
Yeah.
I'll get her in the bin.
Brilliant. I can make sure she's comfortable then with that, okay? Brilliant. Well, I'll just grab these wee inhalers, okay? So the doctor's prescribed 2 inhalers. One is to prevent her asthma symptoms, and that's her brown inhaler. And the other one is the blue one, and that's a reliever to relieve whenever she feels breathless, and it should only be used whenever she feels like really out of breath or needs it, okay? But I can go through those in more detail with Cara whenever she calls in to see me. Both of them are used the exact same way with the spacer device, so I can take you through how to use one, okay? So you get Molly to sit upright and tilt her head upwards to make sure that her airways are open, and that will help the drug get deep into her lungs, okay? So you open up the wee device and make sure there's nothing stuck in the bottom of it. You give it a shake and you place the device inside the spacer and make sure the seal is good, okay? Then you place this bit over Molly's nose and mouth and depress the inhaler and get her to take 5 deep breaths slowly in and out. And then once that's done, that's her having had her dose of medication, okay? Can I check that I've explained that to you, okay, and get you to go through that with me?
Yeah.
Brilliant,
Great.
thank you.
Okay, so I get Molly to sit upright and
Yep.
tilt her neck towards the ceiling.
Yep.
I get the inhaler and shake it.
Yeah,
Check it for any obstructions. Put the inhaler into the spacer
Yeah.
like this, and put the spacer over Molly's nose and mouth. And then I press the inhaler and get Molly to take 5 deep breaths in and out, and I do that every morning and evening.
yes, that's brilliant.
Thank you.
Brilliant. So if Cara wants to call in someday that she's passing and has Molly with her, I can go through that all with her. Would that sound good?
Yeah, I'll say to Cara to pop in Sunday
Brilliant.
after school.
That's great. I'll just bag this up for you, okay?
Great.
2 wee seconds. I'll see you there.
That's great. Thanks for
Okay,
your help.
thanks a
Okay,
million.
take care.
All the best
Bye.
now. Bye bye.